There's an old saying that there's no health without mental health, and I think we could extend that by saying there's no mental health without physical health.
A healthy lifestyle underpins good physical and mental health, and that is the same for a young person experiencing mental health issues as it is for everybody else in the general population.
If you're a young person and you're experiencing this mental illness and suddenly you've put on a significant amount of weight, we've got to think about what impact that has not only on physical health long term and risk of diabetes and future conditions, but also their mental health. And if you suddenly don't recognise yourself when you're looking in the mirror, the toll that can play on making someone's mental health even worse.
If you've got poor physical health that's accompanying your mental health, then that's actually going to increase your level of psychiatric symptoms. You're going to suffer more anxiety and stress and depression, and that actually improving physical health is going to reduce those psychiatric symptoms and psychological effects that are a part of the mental health problem.
Keeping the Body in Mind program was a multidisciplinary lifestyle intervention involving dietitians, exercise physiologists, clinical nurse consultants, endocrinologists, psychiatrists, so it was really a truly multidisciplinary team. And it embedded and integrated this lifestyle intervention within the early psychosis program. And the results were very promising, showing that we could prevent antipsychotic-induced weight gain.
We've known for some time that the medications that are prescribed for young people who are experiencing mental health issues have the tendency to encourage weight gain. And therefore, if you're actually looking at whether a young person is complying with treatment and is going along with the prescriptions that they're being given by their doctors, then actually seeing some weight gain can seem like a positive thing. But the amount and magnitude of that weight gain can have some really serious long-term effects on the quality of life and life expectancy of a young person.
Go Saul! Oh, he's through! Saul with the getaway!
Exercise and mental health belong together. They're both essential in order to get the best positive outcomes for young people.
We do have some good evidence that exercise can actually improve symptoms of not just schizophrenia but also depression and other mental health conditions as well. We also have evidence around cognition and improving other aspects of people's mental and physical well-being.
Motivation is a big factor for people in the general population in terms of being able to start and then continue with exercise. It's only going to be amplified in people who suffer from mental illness as well. And this is where clinicians can play a key role in terms of keeping up that level of motivation. And this is something that everyone in the clinical team can contribute to. Psychiatrists, psychologists, caseworkers, everyone needs to be on message with the young people saying, what are you doing now? What's your level of physical activity? What are the physical activities that you enjoy? What kind of exercise is something that in the past you've enjoyed? Let's see how we can now build that into the part of the holistic program that is part of your treatment.
It's definitely possible to prevent weight gain, and we've shown through the work at the Keeping the Body in Mind project that you can actually prevent weight gain by intervening with appropriate lifestyle interventions at the point of initiation of antipsychotic medication.
The early results from the program demonstrated that a 12-week program can actually see no weight gain occur, and that these results can now be confirmed and extended into the long term. A 2-year follow-up, the same individuals were still showing no evidence of weight gain, even though the intensive phase of the intervention had come to an end after the first 3 months.
One of the really important things with exercise is that we don't need access to expensive equipment or gyms, and again it's fostering what people want to do and encouraging what they want to do. Walking is one of the most accessible forms of exercise that we can do. Simple strength-based exercises can be done with household objects, so it really doesn't need expensive equipment or gym memberships in order to get active.
A mental health professional can do more than enough in terms of prescribing exercise. Sometimes it's very much the case of getting someone out of bed and just doing the very smallest bit. So that could just be walking around the block or even walking to the shops.
What we know is that simply telling people to be more active doesn't work.
There's no one exercise that's going to work for everybody. It's a matter of tailoring exercise to the preferences of the individual, coming up with the strategy that they're going to be happy to pursue and continue in the long term.
One of the key issues we have is this association between exercise and weight loss, and I think it's really important that we separate the benefits of exercise from weight loss. If people are looking to achieve weight loss, then diet modification is a huge part of that and needs to be the priority. Exercise can contribute to weight loss through achieving a deficit in energy expenditure, but it's really not the main reason why we should be exercising. All these other benefits of exercise are how we feel, our mood, our sleep, our fitness, all these other sorts of reasons, which is why we need to be promoting exercise. And the problem with focusing on weight loss is that if people may start an exercise program, they might feel really good, but they might jump on the scales and realise that they haven't changed, and that can be really demotivating for someone. So it's important that we separate exercise from weight loss and promote exercise for the other benefits that it can offer.
When designing an exercise program for someone, it's really important that we consider their physical capacity. So that means determining a baseline level of their fitness and their strength, so that in order to prescribe a safe and efficient exercise program. How's that resistance for you?
It's pretty light.
Pretty light?
Yeah.
Do you want me to put it up just a little bit? So that's when an exercise physiologist can play an important role in providing that exercise assessment, and then anyone can really help implement that assessment. So an exercise intervention delivered by an accredited exercise physiologist will include a comprehensive exercise history, a fitness assessment, depending on what fitness measure we're looking at, maybe strength, maybe aerobic fitness, maybe flexibility. It would also include goal setting, motivational interviewing, and it may also include some counselling and education.
We want people doing more structured exercise that incorporates aerobic exercise, that heart and lung based movement, but also strength or muscle building exercises. But we also want their general lifestyle to involve and encompass that message of moving more and sitting less.
Mental health professionals really need to be actively involved with prescribing exercise and being on top of these clients' goals. So one common example that I often see commonly among my colleagues that are occupational therapists and psychologists is that they might do walking therapy sessions. So they go for walks with their clients and chat about some of the common things that they need to usually discuss in their sessions. Another way to really help engage clients in exercise is using social sport. We have here at the Bondi Centre a group program that includes soccer, netball, tennis, basketball, all those really normalised sports that really get people involved because it's relatable to what they've done in the past, and it really helps improve on their fitness without them even realising.
Today I was just doing a bit of exercise. Yeah, it's good to run out and get about and do some exercise.
Referral to an exercise physiologist can be achieved through three main pathways. The first one is the chronic disease management plan. Now, people can go and see that exercise physiologist if they have diabetes, cardiovascular disease, cancer, or musculoskeletal issues, which are common comorbidities that we do see in this mental health population. The second method that we can do is via private health settings, where exercise physiologists work in the private health system as well. The final option is referral through community-based programs that have an exercise physiologist, including the Keeping the Body and Mind program through the Bondi Prince of Wales Mental Health Facility.
Some of the positive outcomes that can be expected following participation in an exercise program include physical health outcomes such as weight management, reducing risk of chronic disease. Exercise can also lead to improved psychosocial functioning. It can improve symptoms associated with mental illness such as depression, anxiety and schizophrenia. It can improve sleep quality and reduce cravings associated with alcohol and other substances.
Taking the first step out the door is the hardest, just getting started, but once you start getting into that flow and exercising, it becomes easier every day.
Sometimes I feel really unmotivated to leave the house, but once I do, I feel a lot better after, a lot more relaxed and relieved and refreshed.
It keeps you really happy, it keeps you very motivated, especially when you do a lot of goal setting. Having those short-term goals and achieving them, and then that then gives you a lot more confidence and then also increases your motivation.
I feel like there's a holistic approach to health with the Bondi Mental Health Centre. So whilst it's mainly physical, they keep in mind that there's other things that come into play as well.
Holistic care has to be at the centre of what we're doing. For too long we've had this separation between the body and the mind in mental health, and now we have to reintegrate and get those two working hand in hand, because it's only that way that we're going to get the best results for the young person.